Welcome to Chapter 7, the Cardiovascular and Lymphatic Systems. In this chapter, you're going to be able to describe the location of the main cardiovascular and lymphatic structures in the body, define terms related to the heart, the vascular system, and the lymphatic systems, define combining forms, prefixes, and suffixes related to the cardiovascular and lymphatic systems, define common medical terminology related to these two systems, and explain abbreviations used for both the cardiovascular and lymphatic systems. So a little bit about anatomy and physiology of the cardiovascular system. The functions of this system are to transport blood throughout the body, to deliver oxygen and nutrients to body cells through arteries and capillaries, to remove waste products from body cells through capillaries and veins, and to pump blood through the heart with the aid of electrical conduction. Structures of the cardiovascular system are the heart wall. It has its 3 tissue layers. Heart has 4 chambers and valves. The heart muscle and tissues are specialized. Arteries carry blood away from the heart. Capillaries allow for exchange of gases, and veins return blood back to the heart. So here is a diagram of the cardiovascular system. It includes heart, arteries, veins, and capillaries. Functions of the lymphatic system include to return lymph from the body tissues to the blood, to protect the body by filtering microorganisms and foreign particles from the lymph, to maintain the body's internal fluid level, and to absorb fats from the small intestines. Structures of the lymphatic system. Lymph is a clear tissue fluid consisting of white blood cells and a few red blood cells. Lymph nodes filter the lymph. Lymph nodes are primarily concentrated in the neck, the chest, the armpits, and the groin. Lymph vessels transport the lymph from the body tissues to the venous system, and lymph valves facilitate one-way transport of lymph. Blood and lymph flow in the cervical region. So here's a picture. It shows how blood and lymph flow are separate systems. Terms related to the heart, we refer to the cardiovascular system as the heart and blood vessels carrying oxygen and nutrients to the body cells and carrying away waste. The heart is the muscular organ taking deoxygenated blood from the veins, pumping it to the lungs for oxygen, and returning it to the body through the arteries. You're going to need to know the heart and the great vessels. And here's a picture, a diagram, but be sure to review that and you'll be learning all about that. So the heart, when we refer to terms related to the heart, the apex is the lower pointed end of the heart. The septum is the wall of the heart tissue separating the right and left sides. The atrium is the upper receiving chamber of the heart. There's a right and left atrium. The ventricle is the lower pumping chambers of the heart, and there is a right and left ventricle structures. Endocardium is the inner lining of the heart. The myocardium is the middle muscular layer of heart tissue, and the epicardium is the outer layer of the heart. The pericardium is the sac around the heart that facilitates movement of the heart as it beats. And the aortic valve is the heart valve between the left ventricle and the aorta. Additionally, the mitral valve, the bicuspid valve, is the heart valve between the left atrium and the left ventricle. The pulmonary valve is the heart valve between the right ventricle and the pulmonary artery. And the tricuspid valve is the valve between the right atrium and the right ventricle. Blood vessels, when we talk about the vascular system, blood vessels are structures that carry or transport blood. This includes an artery, which is the vessel carrying blood away from the heart. The arteriole is a small artery. A capillary is the microscopic thin-walled vessel connecting arterioles and venules where gas, nutrient, and waste exchange takes place between the blood and cells of the body. Blood vessels continue. The lumen is the interior space of a vessel. The venule is a small vein. The vein is a vessel carrying blood to the heart. The aorta is the largest artery that begins as an arch from the left ventricle and then branches and descends through the thoracic and abdominal cavities, and this carries oxygenated blood away from the heart. The superior and inferior vena cava. The inferior vena cava is the large vein carrying blood to the heart from the lower part of the body, and the superior vena cava is the large vein carrying blood to the heart from the upper part of the body. And here is a diagram showing the superior vena cava and the inferior vena cava. Combining forms related to the cardiovascular system are angio, vaso or vasculo, aorto, arterio, athero, atrio, cardio. And you can see the angio, vaso or vasculo for vessel or duct, aorto for aorta, arterio for artery, athero for fatty paste, atrio for atrium, and cardio for heart. Corono for circle or crown, electro for electric or electricity, myo for muscle, phlebo or veni or veno for vein, pulmono for lung, sclero for heart. Again, sclero for heart, sono for sound or waves, sphygmo for pulse, stetho or thoraco for thoracic or chest, thrombo for blood clot, valvo or valvulo for valve. Combining forms related to the cardiovascular system additionally are varico for swollen or twisted vein, and ventriculo for ventricle. Combining forms related to the lymphatic system are adeno for gland or lympho for lymph. When we look at word parts, prefixes, Brady for slow, D for away or cessation without, endo, in, within, epi, on or follow, inter for between. Prefixes, intra for within, peri for around and sound, tachy for rapid or fast, tel for end, trans for across or through, and tri for three. Suffixes, al, ar, ari, ik, pertaining to, ectasia for dilation or stretching, gram for record or recording, graph for instrument for recording, graphy is a process of recording. Additional suffixes, iso, ol, or ul for small, lytic pertaining to destruction, breakdown, separation, eum for tissue or structure, stenosis for stricture or narrowing. So here are some adjectives and other related terms to the system. Arteriovenous or AV is pertaining to both the arteries and veins. Atrioventricular or AV is pertaining to the atria and the ventricles. Cardiovascular is pertaining to the heart and blood vessels. Constriction is the process of narrowing or tightening of a structure. Cyanotic is pertaining to a blue or purple discoloration due to deoxygenated blood. Deoxygenation is the process of removing or having the lack of oxygen. Diastole is the relaxation phase of the ventricles in the heartbeat cycle. Ischemic is pertaining to the lack of a blood flow. Oxygenation, the process of adding oxygen, and paroxysmal as sudden. Patent or patent, open or exposed. Precordial is pertaining to the anterior left chest. Sphygmic is pertaining to the pulse. Stenotic is pertaining to the condition of narrowing. Supraventricular is pertaining to above the ventricles. Systole is the contraction phase of the ventricles in the heartbeat cycle. Thoracic is pertaining to the chest. Thrombotic, pertaining to a thrombus or blood clot. And varicose, pertaining to swollen or twisted veins. Some common symptoms or terms related to the disorders of heart and arteries and medical conditions. Acute coronary syndrome is ACS, and that's chest pain and other signs and symptoms associated with a cardiac ischemia. Aneurysm is a dilation of an artery, and that's usually due to a weakness in the artery wall. Angina pectoris is chest pain or pressure resulting from lack of blood flow to the myocardium. Angiostenosis is the narrowing of blood vessels. And here is infrarenal abdominal aortic aneurysm, and you can see that in the arrows there. Additional terms related to the heart and arteries. Aortic stenosis is the narrowing of the aortic valve opening. Arteriosclerosis or arteriosclerotic heart disease, ASHD, is the hardening or loss of elasticity of the arteries. Atherosclerosis is the buildup of plaque or fatty paste inside the artery walls. And a cardiac arrest is the complete sudden cessation of cardiac activity. Here we can see the stenosis of a pulmonary valve, and on the left is the normal semilunar valve, and on the right is the stenotic semilunar valve. Here is the progression of atherosclerosis. We can see the lumen on the left is the normal artery with the open lumen. We can see the plaque buildup in the small area of atherosclerosis, and then that continues to build, and we have on the far right almost complete occlusion due to the atherosclerosis, the buildup of the plaque. Additionally, cardiac tamponade is the compression of the heart due to an increase of fluid in the pericardium. Cardiomegaly is the enlargement of the heart. Cardiomyopathy is the disease of the heart muscles. Cardiopathy is any disease of the heart. Cardiovalvulitis is the inflammation of the valves of the heart. Coarctation of the aorta is the narrowing of the aorta, causing hypertension, ventricular strain, and ischemia. Congested heart failure, or CHF, is the inefficiency of cardiac circulation, causing edema and pulmonary congestion. Coronary artery disease, or CAD, is a narrowing of coronary arteries, causing a decrease of blood flow or ischemia to the myocardium. Coronary occlusion is the blockage of a coronary vessel, often leading to a myocardial infarction. An embolus is the vascular blockage made up of a thrombus, bacteria, air plaque, or other foreign material. Endocarditis is the inflammation of the endocardium. Hypertension is the persistently elevated blood pressure. Hypotension is blood pressure that is below normal. Intermittent claudication is the cramping of the lower leg muscle. It's usually caused by a lack of blood flow. Ischemia is a lack of blood flow. A mitral valve prolapse is the backward movement of the mitral valve cusps, allowing regurgitation. And mitral valve stenosis is the narrowing of the mitral valve opening, usually caused by scarring from rheumatic fever. A murmur is an abnormal heart sound. A myocardial infarction is the death of the heart tissue, usually due to coronary artery occlusion. Myocarditis is the inflammation of the heart muscle, and occlusion is a blockage or closure, and pericarditis is the inflammation of the pericardial sac around the heart. I'm going to stop here and move to part 2.